So I want to go over this diagram real quick, and then we're going to go over, we're just going to keep it with the air squat, and then we're going to go over some faults, some causes, and then some therapy that you can do for some of the common faults in an air squat, some of the causes of that, and then, like I said, some of the therapies. So first off, the quick anatomy and physiology lesson is, when it comes to coaching, good coaching requires efficient communication. So basically what this little diagram has done is broken up kind of the anatomy into four parts, okay? We've got 1, 2, 3 different joints, and then 2 basic movements, right? So we'll kind of go in reverse here a little bit. Basically what we're looking at when we're looking at the body, right, we're kind of looking at these 4 parts, and we're looking at what parts are flexing and what parts are extending, okay? To kind of break this down a little bit further, like I said, we've got 3 different joints that we're looking at. Obviously the knee, the hip, and then what we'll call the SI joint. The SI joint is the spine, where the spine and the pelvis connects. Okay. The hip is where the pelvis and the femur connect, and then the knee is obviously where the femur and the tibia connect. Okay. So you can see the quick diagram of that is if we flex and extend our knee, right? Flexing our knee looks like this. Extending our knee looks like that. The same thing with our hips. If we flex our hips, we're flexing our hips, we're extending our hips, right? Okay? And then, instead of saying our SI joint, we're just gonna say our trunk. So you can imagine flexing your trunk and then extending your trunk, like so. So we kind of understand how we use that, when we're coaching, right? When somebody's doing an overhead squat, and they're obviously they're overextending themselves in that overhead squat, and they can't figure out why they're doing it wrong. Simple anatomy, we can explain this to them. You're extending your rib cage, therefore you're getting out of position. Most of the dynamics that we do are primarily the hip extension. So all of our lifting and stuff predominantly revolve around the extension of the hips. So squat therapy, squat clinic, there's a couple other names, that we call that. I'm not sure what they are. We'll go with squat therapy. The main thing here, when it comes to basically your back, your hips, and your knees, right? If you are not doing those things, even if, for example, if you don't have any back pain, but you don't work out, if you don't have any hip pain, but you don't work out, and you don't have any knee pain, but you don't work out, or you don't, flex and extend these to full range or end range, and you don't have pain when you do that, like, oh, look, no pain, right? If you're not actually able to do your full range of motion and with those 3 joints, that doesn't mean that you're healthy. Okay, so if somebody can basically do a quarter squat, and they're like, oh, well, I have no pain. Well, that's good, but do you have pain if you go further than that? A lot of times people just are negligent of that, especially when they're untrained. So you want to make sure that that they're able to do these movements, and by avoiding them is not necessarily a good thing, right? And in fact, if you do have wonky or kind of cranky knees, right? A lot of times getting it to that full range of motion is actually going to put it in a healthier environment to heal, rather than leaving it alone and not doing anything, right? The squat in the bottom position is nature's intended sitting position, and rising out of the bottom of the squat is nature's intended standing position. So being able to do those efficiently is actually it by no means is is it some new age idea like, oh, we're supposed to do this. It's actually pretty natural and necessary, right? So squatting, like we talked about in probably one of our earlier lessons, squatting is one of the best exercises to elicit a neuroendocrine response. Do you remember what that means? Do you remember what it means? The neuroendocrine response?
What is eliciting it?
The squat is the benefits of a squat, or just squatting in general, is one of the best exercises to elicit a neuroendocrine response, which basically means a neurological response or a hormonal response, right? So the more you squat, the stronger your muscles get. The more you squat, the more responsive you're able to develop things like flexibility and stuff like that. So again, going back to that, squatting is not it's not a want. It's definitely a need. Okay. So the air squat. So like I said, what we're going to do is we're going to try to recognize some faults, and then we'll go into some causes and some therapies. Did you get a chance to read over any of the causes or the therapies? I can go over those really quick if you want. Okay, so causes of a bad squat, right? So these are all very similar causes, not similar, very obvious things. So the cause of a bad squat would be something like a weak glute or a weak hamstring. Poor engagement, really poor engagement anywhere, in the core, in the quads, in the glutes, and the hamstrings. Weak control and no awareness of your glutes or hamstrings, different movements, coming off of the heels, rounding the back, things of that nature. What's that?
The lack of mobility in your ankles.
Yeah, exactly. So kind of coming into these faults here, which we're going to start recognizing here. Again, using your quads in there. Yeah, go ahead. Just move that stuff out of there. Leg extension dominant over hip extension, right? So you probably see that a lot in a squat as people are just really kind of grinding their legs and their knees into that and not focusing more on the hip extension. Obviously, one of the causes is inflexibility. Tight hamstrings are powerful conductors, to slipping into lumbar flexion or rounding our back, which is probably, if you think about it, not so much in the air squat maybe, but when you add weight to it, rounding your back is probably the most detrimental in the back squat, right? Things like poor focus, sloppy work, right? We all have that. You have a pretty heavy back squat, repping it out. Every once in a while, you don't get the best quality rep. Poor engagement in your core, not breathing properly. It says here incredible effort. But more than anything, the more that you work on your squat, and more specifically, the more that you concentrate on your squat, the better it's going to get, right? So the worst thing that we can do is just blindly just start squatting and not ever try to get better at it. When it comes to the squat, it's something that you're always going to try to focus on and try to get better at. Some of the therapies, and these are going to be more demonstration. I don't know if you went over those in the book. We talked about things like bar holds, basically putting a bar in the rack and then squatting down and being able to hold on to that. Bottom to bottom, which is pretty much exactly what it sounds like. You go into the bottom of the squat, you stand up, and then you go back down. So you're going to hold in the bottom of the squat, come up to full extension, and then drop right back down into it. Obviously, for the air squat, you can reveal a lot of faults here if you just do an overhead squat, not necessarily a weighted overhead squat using a PVC. Very simple. You can notice a lot of good technique and more specifically a lot of bad technique. Just practicing the air squat is a therapy sometimes. Sometimes you can't really pick out what's wrong with somebody, right? They're executing it for the most part properly, but that something's just kind of off, or maybe it's a bunch of little things that are off, and just practicing that, right? Or if you can't quite put your finger on it, Maybe you change the exercise up. Maybe you have somebody do a front squat, right? And then that will kind of reveal some issues. So, if somebody's air squat looks okay, you can't quite put your finger on it, but then when you have them grab an empty bar or a trainer bar or even a PVC, and you notice, yeah, you know what, they do have a little bit more rounding in their back, or they're dropping their elbows, they have really poor core engagement, or maybe a lot less hip flexion and a lot more, leg extension. And again, if all else fails, have them do a PVC overhead squat, because, like I said, if they can kind of get away with any of those others, they will not be able to. But something's wrong, they will not be able to do an overhead squat. And then, like I said, those faults will be a lot easier to recognize in an overhead squat. Make sense? Okay. So let's talk about some faults. And I just mentioned some. We're just going to kind of go, what's the fault, what's the cause, what's the therapy? And, again, more than anything, what I'm looking for you is you name the fault, and we can talk about the cause and the therapy together.
Well,
So rounding the back, right? The technical term, surrendering of the lumbar curve at the bottom, right? So basically, we're flexing down. So we're just for that lumbar curve, right? Rounding at the bottom. What do you think the cause of that is?
not engaging your core.
Not again, lack of, absolutely. Anything else? Anything from an anatomy standpoint? Or a neurological standpoint, I guess. So a lot of times when you see somebody rounding their back, what do you say to them real quick? Straighten your back, right?
Yeah.
And then instantly I forgot about that, right? Because it's an air squat, they don't know what they. So again, just like a lack of focus.
Like a trick question.
Yeah. Again, it's kind of set up to almost trick you, right? But you just have to think of when you're coaching somebody, right? Oh, you're rounding your back. Hey, stop rounding your back. Sometimes you say that, and instantly they're like, oh, hey, they can fix that. So a lack of focus is definitely, could definitely be a cause. Something along the lines of tight glutes or hamstrings, right? So when our glutes, our hamstrings, or even our core for that matter, right? So we can even have core. What happens? Our bodies are great compensators, right? So if something is tight, we try to compensate, especially in a squat. What do we do? What do you see when somebody has, let's just say, both tight hamstrings and glutes? What do? Instantly, right? Some people think that this is a squat, right? And then usually they cheat for balance, kind of that same kind of demonstration. So we're rounding our back. We've got a couple of causes here. What would you say would be the therapy for that? And don't cheat and say overhead squat every time.
You go to the rig and squat against the bar so that you can't bend over and curve your back.
We'll just say rig, using a target, right? You could also use a wall. I like the rig a lot more because people can, they can be there, and then when they do fail, they can hold on, right? With the wall, right? If you start to do this, you're gonna fall back, and then that's when we would squat to a target, or you'd have somebody there to catch you, trust fall, something along those lines, right? Can you name another fault?
Not getting below parallel.
Oh, that's a good one. And what would be the cause of that?
I'm trying to think of Taylor doing squats. Like tight.
Yep.
Just tight. Tight all
So
over.
we'll say tight glutes, tight hamstrings. It could be tight a lot of things. Again, probably the most common would be you could have your tight glutes, tight hamstrings. You could be quad dominant. That's usually what that means is when these are tight, you're gonna use more of your quads. Could be weak hip flexors, right? Think of people sitting all the time. Those hip flexors are relaxed, they shorten, they're not really strong, people are not used to it. You know, a lot of times, you know, we have people come in here that have desk jobs and, you know, they're sitting on it. What would you say would be the therapy for this?
Doing targets and progressively getting a smaller target or a shorter target out.
Squat into a target. Anything else?
Adding weight will push you down a little bit. You could do different stretches to help loosen up
Yeah.
your legs before squatting.
So yeah, and what I just talked about, one of the therapies is the bottom to bottom, right? I'm a firm believer that, you know, just and even when we talked about the rig, right? Spending time in that bottom position, right? It's kind of like you're retraining yourself. It's kind of like you're retraining your brain to know what that feels like. So the question that I want to sometimes smack people when they ask me is, was that low enough? You know if it's low enough, especially if you can get into the bottom. So if you have to ask, the odds are it probably wasn't low enough, right? So if you practice it enough, you don't have to ask. They don't have to ask, right? So spending time, like I said, something like a bottom to bottom, or, you know, a squat hold. Like I said, you could use the wall, you could use the rig. Anything else? Another fault, rather.
Your ankles coming off the ground, or not your ankles, your heels coming off the ground.
Lifting the heels. What do you think the cause of that is?
Like your ankle mobility is not there.
Okay. Mobility for sure.
Tightness in your calves.
We could have tight calves, again, tight glutes or hamstrings. You know, could be a balance thing, right? What about the therapy?
Just stretch your well, would it be therapy to get a mat or a plate and put on your leg?
That's thinking for yourself right there, right? So we'll just
But
say
is that
plates.
fixing the problem though if you're lifting the foot up at all?
You're talking about putting your heels on a plate, right?
Yeah, during the squat, yeah.
During the squat, yeah, that's totally okay. Yeah, and again, like I said, that wasn't even on the list, but that's gonna, again, going back to just not being able to get below parallel, right? And then spending time in that squat. Same deal here. You're manipulating essentially the standing position so that they can feel what that feels like, right? And then you take those plates away. Over time, they're going to be able to squat lower and lower, right? Because they're practicing. Again, kind of going back to that. The therapy kind of retrains your brain, kind of like what we were talking about in Corey's office, right? He's retraining me to activate certain muscles, and do that efficiently and work on my endurance with that. Anything else? Think of the squat. Think of things that you see and how you with the cause of it, and then if you don't know the cause, but you can do the therapy, that's fine. We can fill that in.
The chest coming down and not staying upright.
Mm-hmm. Okay.
And I mean therapy for that. I know it's another like rig or wall.
Mm-hmm.
I've done that. Cause for that, I would say would just be tight again, tight glutes, tight hamstrings, tight everything.
Yeah. I mean, it could be a weak, upper back, right? Something could be tight. Could be, it could even be, tight upper back or tight shoulders, right? So again, like I said, when these things happen, what we have to realize is, like heels lifting off the ground could be weak ankles or lack of mobility in our ankles. Chest forward, that could be, again, it could be weak shoulders, it could be weak upper back, it could be tight hamstrings, tight glutes, something like that, right? How would you fix it? You already got that one. Anything else? There's one more very common thing, right? I've got 2 others here that we'll go over, but there's one that happens quite a lot that I know that you know the cause of it, and you definitely know the therapy. Think about that squat. Think about things that go wrong in a squat, especially if you're thinking of like somebody like Taylor or somebody like.
That's her biggest thing is her chest forward. She can't get below parallel.
Yeah, but think of her in like a front or a back squat when.
The elbows. But
yeah, but no, not necessarily the elbows, but when she adds heavy weight, right?
Lumbar or your knees.
Yeah, knees going in, right? Knees going in, right? They kind of get that little dip.
Yeah.
That could be something anatomy-wise. That could be weak abductors, weak adductors. It could also be a lack of like focus. Again, with that one, just kind of like when we say, hey, stop rounding your back, and then instantly they fixed it. We say, hey, push your knees out, and then we instantly fixed it. Sometimes it can be that easy. Sometimes it's just a lack of focus.
Yeah.
And that's why we give those verbal cues. And then, you have that one person that's like, I can't, right? Because they don't understand. So, the cause of that could be anything. It could be something weak. All that stuff, right? What would you do to fix this? Right? We could obviously use a verbal cue. What's that?
Verbal cue.
A verbal cue, but let's say it's a little bit more difficult than that. So let's say it's something that we have to apply to their squat. And just think of yourself, think of how you would handle that situation. I come in and, I just dip my knees in when I'm squatting. How are you going to fix that?
I don't know if it's right to rotate your feet or like just change your standing,
Mm-hmm.
make it a little wider until you can.
So what you're saying is maybe change the feet position, change, manipulate, yeah. Change the stance. For sure. I can totally do that. All right. Anything else? So when it comes to that, like I said, that's a pretty common. This one's pretty common. Knees coming in. The easy thing for me is to use something like a band. So when we add resistance, right? Yeah, even if you have to tie a band, right? Because most of our bands are a little bit bigger. We've got some thinner ones that you double up on or whatever. And what ends up happening is you'll notice, what that does is if they stand like this, it's tight. But the moment those knees go in, that band starts to shimmy down their leg, right? So what that does is that it allows them to engage and continually push those knees out as they go into the squat, right? So a band, I would say, is probably your best bet with that. You could also have them, squat to a target and verbal cue knees out before they come up, right? Again, trying to retrain their brain. I'm not going to write these on the board. I'm just going to briefly go over them. They say common, but not necessarily common. I think they're kind of stupid. It's something more that a verbal cue will really get them to kind of figure out. Not fully extending at the top of the hips, right? So we think of our air squat, right? What do people do? What do people do? They get up here, or maybe they finish, but they're like this, right? Realize that extension, going back to this diagram, right? What's not extending here?
Your hips.
Hips, right? They have to fully extend the hips, right? All of these have to be fully extended for them to finish their squat, okay? So for the most part, that's probably a lack of focus. Therapy, smack them around, tell them to focus, right? And then the other thing would be dropping their head. A lot of times, especially when we add weight, what do I tell people? I'm telling them to look at the walls, find a dot, find something, right? Whatever it can, something that's at eye level so that you can focus on that, because when we add something like a front squat or even an overhead squat or back squat, what does everybody want to do? They want to look to the ground, right? So simple. Again, it's more of a focus thing, but it's something very common, but something that's pretty easy to fix. All right.